Welcome to the PrepNet, presented every Sunday at 6 p.m. Eastern Time on Talk2Me's Channel 14. Come join us to discuss everything about prepping and hear what others have done. Medical Preparedness for Preppers, Part 3. Disclaimer. Please be aware that this series on medical preparedness may include topics or descriptions that some listeners may find uncomfortable. This presentation is for educational and preparedness purposes only and is not medical advice. We will not go into graphic detail, but we will mention topics and areas you may want to research further as part of your own preparedness planning. Medical procedures should only be performed by properly trained individuals operating within their level of knowledge, skill, and legal authority. In a real emergency, seek professional medical care whenever possible. In Part 2, we covered bleeding control and trauma care, CPR, cardiac emergencies, and AEDs, airway and breathing problems, fractures, sprains and mobility injuries, burn care, illness and infection management, dental emergencies, and medications and long-term health conditions of the basic first aid supplies topic. We will now complete the basic first aid supplies topic and then move into the advanced first aid and trauma training. Many people depend on medications to survive. Preparedness planning should consider prescription medication storage, rotating medication supplies, backup glasses, medical devices requiring power, refrigerated medications, oxygen needs, and mobility limitations. Examples of critical medications may include insulin, heart medications, blood pressure medications, asthma inhalers, seizure medications, and antibiotics prescribed by physicians. Medication shortages become a major issue during disasters. People should work with their healthcare providers whenever possible to legally maintain emergency reserves. Additional ways some people prepare medication reserves may include requesting 90-day prescriptions instead of 30-day refills when allowed, refilling maintenance medications as early as insurance rules permit, and rotating the older supply forward, using mail-order pharmacies that may allow larger refill quantities. Discussing disaster preparedness concerns directly with healthcare providers, especially in rural areas or regions prone to storms, fires, or extended winter conditions. Maintaining travel medication supplies for extended trips. Carefully rotating over-the-counter medications and monitoring expiration dates. Maintaining backup eyeglasses, spare batteries for medical devices, and printed medication information. Preparedness groups should also understand that some medications require refrigeration or strict temperature control, such as insulin, making backup power or alternative cooling methods extremely important during outages. Heat, freezing temperatures, moisture, and sunlight can damage many medications and reduce their effectiveness. And some medications are highly regulated and may not legally allow extra stockpiling, including certain narcotics, stimulants, and controlled substances. People should never illegally obtain, improperly share, or misuse prescription medications. Medication planning should always remain legal, responsible, and coordinated with qualified medical professionals whenever possible. Now let's move to the advanced first aid and trauma training. Basic first aid is only the beginning. Many preppers choose to pursue advanced training. Examples may include wilderness first aid, wilderness first responder, EMT training, stop the bleed courses, CERT training, search and rescue training, disaster medicine courses, or ham radio emergency communications. Wilderness medical training can be especially valuable because it focuses on delayed evacuation and extended patient care. In a large-scale disaster, you may effectively become a wilderness responder, even inside a city. Some preppers expand beyond standard first aid kits and build larger medical capability. Examples of higher-level equipment may include advanced trauma kits, stethoscopes, blood pressure cuffs, glucometers, suture kits for properly trained users, irrigation syringes, sterile instruments, medical reference books, pulse oximeters, airway adjuncts, oxygen systems, portable suction units, folding stretchers, cervical collars, portable lighting, and backup refrigeration for medications. However, equipment without training can be dangerous. Owning advanced tools does not automatically create advanced medical capability. Preparedness should focus on matching equipment to realistic skill levels. In a long-term disaster, supplies may run out. People may need to improvise. Examples include improvised splints, boiled and disinfected cloth bandages, improvised litters and stretchers, alternative sanitation systems using clothing for wound pressure, and improvised hot and cold therapy. This is where knowledge becomes more important than equipment. A trained person with limited supplies may outperform an untrained person with expensive gear. Austere medicine also emphasizes conservation of supplies, infection prevention, patient monitoring, cleanliness, proper documentation, and prioritization of limited resources. Internet access may disappear during emergencies. Physical medical reference materials are important. Examples may include first aid manuals, wilderness medicine books, medication references, emergency childbirth guides, nursing references, disaster medicine guides, CPR charts, and anatomy references. Printed references can help refresh memory during stressful situations. Waterproof storage is recommended. Sanitation is one of the foundations of preparedness medicine. Without sanitation, disease spreads rapidly. We discussed this in our 4-part topic on sanitation, but we'll quickly recount that information. Preparedness sanitation planning may include hand washing stations, soap storage, bleach and disinfectants, waste disposal plans, toilet alternatives, laundry capability, isolation procedures for illness, pest control, and clean water systems. Medical gloves and masks are useful, but cleanliness and hygiene habits matter even more. A group with poor sanitation may become medically overwhelmed very quickly. Next week, we will finish the medical preparedness for preppers topic. If you have any questions about what we have discussed here or anything about prepping, send your question to prepnetch14@gmail.com and enter question in the subject line.